Before anyone decides whether HRT is right for them, we need to talk honestly about the risks, because understanding isn't built by looking only at the positives. It's built by seeing the whole picture. The greatest gift we can give ourselves isn't finding the perfect treatment. It's finally understanding why we've been feeling the way we have. Because once understanding replaces self-blame, healing often begins. Get comfortable and let's look at the evidence. I've drawn an old-fashioned weighing scale. So on one side it reads benefits and the other reads risks. Neither side is lower than the other. Whether we're taking antibiotics, pain relief, having surgery, vaccines or hormone replacement therapy, there is no treatment that is completely without risk. And equally, there are very few treatments that are completely without benefit. Medicine has never been about finding treatments with no risk. Medicine is about a different question. Do the likely benefits outweigh the potential risks of this particular person? And that is one of the most important questions in healthcare. And I also think it's one of the most misunderstood, because we live in a world of headlines: miracle treatment, dangerous drug, doctors warn, scientists discover. Life becomes black or white, safe or dangerous, good or bad. But medicines rarely work like that. Most decisions happen somewhere in the shades of grey. So if you're watching today because you're wondering whether HRT is something you might like to explore, I don't want to tell you what to do. I want to help you understand how these decisions are made, because understanding allows you to have a better conversation with your healthcare professional sitting opposite you. So understanding the risks. If we draw a simple path, imagine this path represents life and we're walking along it. So there's a few stones on the path. Imagine this path for all of us represents life and we're walking along it, but none of us are walking exactly the same journey. So these little stones represent different things that influence our health: our genes, our age, whether we smoke, our blood pressure, our weight, our family history, and medical conditions that we may already have. And yet, one of those stones might be HRT. But notice something, HRT isn't the whole path, it's just one part of the bigger picture. Sometimes I think we forget that. When scientists study HRT, they're not asking whether women have any risk at all. They're asking a different question. Does using this particular type of HRT change a woman's existing level of risk? Sometimes the answer is yes, and sometimes the answer is no. Sometimes it depends on her age, sometimes it depends on the type of HRT, sometimes on how it's taken, and sometimes on her medical history. That's why a newspaper headline can never tell your personal story. Let's look at two women. So I'm just going to draw stick figures because that's basically all I can draw. Art was never my strong point. I know, stick to my day job. So let's imagine these two women. The first one is 46. She doesn't smoke. She hasn't got high blood pressure. She exercises regularly and she has no significant medical history. Now let's imagine the other lady. She is 58. She does smoke. She has high blood pressure and she has blood clots. Perhaps she's living with diabetes as well. Now here's my question. Should these two women receive exactly the same advice? Probably not. And that's good medicine, because medicine doesn't treat headlines. Medicine treats people. That's why your friend may have been offered HRT while someone else wasn't. It isn't because one woman matters more. It's because every woman's health story is different. So let's talk about breast cancer. This is understandably one of the biggest concerns women bring to the conversation. Breast cancer touches so many families, and hearing the words increased risk can immediately create the fear. And this is where understanding really matters. The evidence we have today is far more detailed than the headlines many of us remember from 20 years ago. Different types of HRT have different risk profiles. Combined HRT and estrogen-only HRT are not the same. How long somebody uses HRT matters. Whether they've had a hysterectomy matters, their age matters, their overall health matters. And it's also worth remembering that breast cancer risk is influenced by many other factors too, including getting older, alcohol intake, body weight after menopause, and levels of physical activity. So rather than asking, is HRT safe? A better question is, what does the balance of benefits and risks look like for me? That's a much more helpful conversation. So blood clots and stroke. Another question I hear frequently is, I've heard HRT causes blood clots. Is that true? Again, the answer isn't simply yes or no. Research suggests that HRT delivered through the skin, such as patches or gels, appear to carry a lower risk of blood clots for many women than HRT taken as a tablet. That's one reason why your clinician may recommend one form over another. The simple principle applies when we think about strokes. Age, blood pressure, smoking, and your wider health all contributes to that individual risk, which is why one treatment doesn't fit everyone. So family history, one of the most questions I hear is, my mum had breast cancer. Does that mean I can't have HRT? The honest answer is not necessarily. Family history is important, but it isn't automatically the deciding factor. It's one piece of a much larger jigsaw. Sometimes HRT may be appropriate, sometimes a different approach may be safer, sometimes you benefit from seeing a menopause specialist. The important thing is not to make assumptions before you've had that conversation. So if HRT isn't right for you, not every woman can take HRT. Not every woman wants to take HRT. And both decisions deserve complete respect. There are non-hormonal prescription treatments that may help some menopausal symptoms. There are lifestyle changes that can support your overall well-being. There are psychological therapies that can help if anxiety or low mood have become part of your experience. This is never about saying there's only one answer. It's about finding the answer that's right for you. I've learned that people rarely regret making informed decisions. They often regret making frightened ones. My hope isn't that this video tells you what to do. My hope is that it gives you enough understanding to ask better questions and to have conversations and ultimately make the right decision that's right for you. So a gentle truth, the goal isn't to find the treatment that's right for every woman. The goal is to help every woman find the treatment or combination of support that's right for her. And those are two very different things. There's something I've been wondering. Behind every statistic, there's a woman, a real woman trying to hold her life together, trying to be a good mum, a good partner, a good friend, and trying to keep working, trying to remember appointments, trying to smile when she feels like crying, trying to understand why she doesn't feel like herself anymore. And perhaps that's the part we don't talk about enough. So today, I'd like to tell you a little about my story, not because my experience is more important than yours, but because maybe you'll recognise a little bit of it in yourself. I often look back now and realise that my story probably began before I even knew the word perimenopause. I was approaching my 40s. On the surface, life looked normal, but something inside me was changing. I found myself questioning everything: the career I built, the things I'd always enjoyed, the direction of my life I was taking. At the time, I couldn't explain it. I simply thought something isn't quite right. Looking back, with everything I know now, I wonder whether that was the beginning of a transition that had already quietly started. Then life surprised me. At 42, I became pregnant with my youngest daughter. To this day, I still smile when I think about it. She was and always will be one of life's greatest gifts. But around 6 to 12 months after she was born, everything seemed to change. The hot flushes began, the night sweats, my emotions felt unfamiliar, my marriage was struggling. I felt low, overwhelmed, confused, and like so many women, I thought the way I was feeling must simply be because life was difficult. So I went to my GP, not because I thought I was perimenopausal, because I genuinely believed I was struggling emotionally. I explained everything that had been happening. I expected the conversation to focus on stress or depression or my circumstances. Instead, something extraordinary happened. The local GP looked at the whole picture. She listened, really listened, and then she asked a question that changed the course of my life. She said, "I wonder if this could be hormonal." She explained that although I'd recently had a baby, I'd also gone through many months without a period, and she wanted to investigate that further. Blood tests were arranged, and the results suggested that I had entered menopause much earlier than I had expected. Today, we know that hormone blood tests aren't routinely needed to diagnose perimenopause in most women over 45 because hormone levels fluctuate so much. With a recent pregnancy and an unusual pattern of symptoms, they've formed part of a much wider clinical assessment. And that distinction matters because good medicine isn't about ticking boxes, it's about listening to the person in front of you. That conversation changed everything, not overnight, not magically, but it gave me something I haven't had before, an explanation, and sometimes an explanation is the beginning of hope. I was prescribed estrogen and progesterone over time. My symptoms improved, I slept better, my hot flushes settled, I began to recognise myself again. HRT has been an important part of my journey, and personally, I have experienced significant benefits. That doesn't mean it will be the right choice for every woman, but it's the right choice for me, and I'm grateful I had a doctor who was willing to consider it. I continue to take HRT after regular reviews with my healthcare team, and I'm thankful that it remains an appropriate option for me. But here's something I've learned through years of counselling. The hormones were only part of the story because when a woman spends years believing she's becoming weak, difficult, forgetful, emotional, she doesn't just lose confidence in her body, she begins to lose confidence in herself, and that's much harder to rebuild. I sat with women who have apologised for crying, apologised for forgetting words, apologising for feeling overwhelmed. They're adapting to one of the most significant biological transitions of their life, and they deserve compassion while they do it. It's not that HRT is the answer. It's not that every symptom is hormonal, and it's certainly not that there's only one right way to navigate menopause. It's this: please don't dismiss yourself. If something feels different, if you no longer recognise yourself, if you're struggling, you deserve to ask questions, you deserve to seek support, and you deserve healthcare professionals who will listen carefully, consider the whole picture, and work with you to find the most appropriate path. And if the first conversation doesn't give you the answers you need, it's okay to seek another opinion. Advocating yourself isn't being difficult, it's taking your health seriously. There comes a moment in a woman's life where they look in the mirror and quietly wonder, what has happened to me? If that's where you are today, I want you to know this: you haven't disappeared, and you haven't become less capable, and you haven't lost your worth. Your body may be changing, your hormones may be changing, your life may be changing, but you are still you. And with the right support and the right information and the right conversations, you can learn to trust yourself again. If this video has helped you understand yourself or someone you love, then I hope you'll share it, because somewhere, perhaps today, another woman is sitting outside a GP surgery wondering if she's losing herself, and perhaps this conversation will help her realise she isn't. So thank you so much for watching and supporting, and I will see you in the next video.